focus on the topic of aphasia. So we're going to look at aphasia and what are the related conditions to the aphasia. So to begin with, first we are going to look at the vernix. So in terms of vernix, we are just going to write some components. So first one will be comprehension. First we are going to look at C. C for comprehension. Next, the repetition of spoken language. R for the repetition of the spoken language. And then we have the naming. And then comes the F for fluency. So let me write R down. R is nothing but the repetition of spoken language. Now let's see each of the conditions. So to begin with, we already told we are starting with the vernix. So in terms of vernix, the comprehension is impaired. Then the repetition of the spoken language is also impaired. Then the naming is impaired as well as the fluency. This is preserved. It is preserved. Next, we are going to move on to the Broca's. So what happens to the Broca's? So in terms of the Broca's, the C what we dealt with is nothing but there is C for the comprehension. So C for comprehension because of the Broca's is preserved, and the repetition of spoken language, it is impaired. And then the naming is impaired. What about the fluency? Fluency is decreased in case of the Broca's, whereas in case of the vernix, the fluency was preserved. Next, we are going to look at the global. So under the global, there is looking at the comprehension. C for the comprehension. So under global, the comprehension is impaired. The repetition of spoken language impaired, and then the naming is impaired. And here the fluency, it is decreased. The only thing that is decreasing is the fluency. Next, we move on to the conduction. So under the conduction, we need to know the comprehension. This is it is preserved. Next, it is impaired, and when you look at the fluency, it is preserved. The fluency is again, it is preserved. So in conduction, the C and F, they are positive. That is the comprehension and the fluency. Next, we are going to look at the anterior. So anterior is nothing but the non-fluent. That is a transcortical. So here if you see the comprehension, it is preserved. Comprehension is preserved. Then the repetition of spoken language is also preserved. And the naming, it is impaired. Then when you look at the fluency, it is also impaired. So in aphasia, the C and R it is preserved. That is a comprehension as well as a repetition of the spoken language. Next, we are moving on to the posterior. So the posterior, it is known as the fluent transcortical. So under the true fluent transcortical, the C, that is the comprehension, it is impaired. The C is impaired. The R, it is preserved. So if you see the R, that is the repetition of spoken language, is preserved in both anterior transcortical as well as the posterior transcortical. Next, when you're looking at naming, in naming this is impaired. In naming it is impaired. And then when we move on to the fluency, it is preserved. So here in the posterior, the repetition of spoken language as well as the fluent as well as the fluency, both are preserved. Then we are moving on to the isolation. So what happens in the isolation? So in case of isolation, the comprehension in isolation, it is impaired. The comprehension is impaired. Then when you're looking at R, that is a repetition of spoken language, it is echolalia. Then looking at naming, it is impaired. And looking at the fluency, fluency is no purposeful speech. There is no purposeful speech. So we dealt with isolation. Now we are moving on to anomic. So under anomic, the comprehension, if you see, it is preserved. The comprehension is preserved. Then what about R? R is a repetition of the spoken language. The repetition of the spoken language is again, it is preserved. Then N. N is the naming. Naming is impaired. So what about the fluency? The fluency is that it is preserved except for word finding pauses. It is preserved except for the word finding pauses. Word finding pauses. Then we move on to the pure word deafness. Pure word deafness. Pure word deafness. So the pure word deafness, it stands for the comprehension being impaired. So it is impaired, and this is for only spoken language. Is impaired for the spoken language. Then R. R is for the repetition of the spoken language. So this is impaired. Then naming, if you see the pure word deafness, it is present, that is preserved. And then looking at the fluency, it is again preserved. Then we move on to the last, that is pure ataxia, alexia. So here, what are the findings? Comprehension is impaired only for the reading. It is impaired for reading. So repetition of the spoken language, it is preserved. Naming is preserved. So what about the fluency? Fluency is also preserved. So this was about the aphasia as well as some of the related conditions. To learn and grow daily like this, please do subscribe.